Please state your name and tell us a little about yourself.
Hi, my name is Darius Becker, and I'm an undergrad student at the College of Charleston, majoring in biology with a minor in neuroscience.
If you could summarize your image of nursing into one word, what would that one word be? Give us a positive and a negative word.
In terms of a positive word, I would say personable. In my personal opinion, I feel that doctors have an elitist kind of personality and that they feel that they're above their patients because they have an MD, whereas nurses seem to be more, as I said, personable. They interact with the patients more and they feel like they bond with the patients at a different level than the doctor would.
And what would your negative word be?
In terms of a negative word, I think it's possible for nurses to become jaded. In time, as a nurse works in the hospital setting or the healthcare setting in general, they may lose enthusiasm for their job and maybe stop caring as much and look at their job as just being a job and not really caring for the patient. And so, over time, I feel that a nurse can become jaded.
Okay. Tell us how an interaction with a nurse has made a difference in your life.
Last summer, I unfortunately suffered 2 spontaneous pneumothoraxes back to back, and being in and out of the hospital with doing surgeries and different tests and x-rays and whatnot, I was able to interact with the different levels of the hospital, being doctors, nurses, and lab techs. And I would say that my interactions with the nurses were probably the most pleasant interactions of the whole experience in general. One nurse in particular, I remember her name was Lisa. Whenever she would come and give me my medications and whatnot, she would actually stay and chat with me for 30 or 40 minutes. And throughout my stay at the hospital, we actually became, it almost seemed like we were friends. It was kind of cool.
Okay, and do you have any recommendations for future nurses?
If I could give one recommendation for future nurses, it would be that, referring back to what I said earlier about being jaded, that if over time you find yourself to stop enjoying your job as a nurse and you start losing enthusiasm for what you're doing, I think maybe you should take a step back and reevaluate your job and what your goals are and what you want to get out of being a nurse. Because as a nurse, I feel that you have the most crucial part of the whole healthcare process, and that because you spend the most time with patients and you have the most interaction, you're going to be the impression that the patient will receive and will have whenever they think about going to the hospital. And if they have if they associate the hospital with a negative environment and have bad memories of poorly acting nurses, then that may discourage them from going to the hospital if they have an ailment. And that's the last thing that you want to happen. So, as a nurse, I feel like you need to make sure that you actually want to be a nurse and that this is a job that you want to do.
Okay, well, I appreciate your feedback. Thank you for your time.
Yeah, no problem.